to Victoria's virus crisis. Not just Victoria's crisis either. 3 cases from Victoria spread to the ACT. But in Victoria, 165 new infections today. That's the second highest total after the record 191 on Tuesday. So it's still very, very serious, but at least it's not increasing exponentially. Now, those 9 Housing Commission towers, 3,000 people in them, that the government put in total lockdown, 159 sick people between them. That is a lot. But 8 of those towers are now out of that total lockdown, but like the rest of Melbourne, they'll still be under the stage 3 bans for the next 6 weeks. Now, no new deaths though, and just 9 Victorians in intensive care. So, what next? Joining me is Professor Tony Blakely, epidemiologist and public health medicine specialist at Melbourne University. Professor Blakely, it's great to have you back again. Can you explain why this outbreak happened in Victoria of all the states?
2 reasons. First of all, we actually did have low-grade community transmission, so we were going to get the virus breaking out at some point. But it's been brought forward in time and with greater intensity because of the muck-up, basically, with the quarantine here, whereby it leaked out through the security guards into the northwestern suburbs and boom, off it went.
Now, the numbers, you know, when we had 191, we thought, on Tuesday, we thought if it keeps going exponentially up like this, we could be in desperately serious trouble. Now, it was 130-something the day after, 165 today. How serious is this?
This is serious. So those numbers went up quite high. Some of that was bringing forward of the cases in time because they've been detected because of quite intensive testing. The rate, however, is high enough and the cases are popping up elsewhere and, of course, now it's spilling across borders. So this is an extremely serious situation for Australasia where we don't want to have much virus circulating or even get rid of it entirely. If this was in Europe, it would be a different case. But given that New Zealand's eliminated and other states and territories in Australia have eliminated, this is a really bad situation for Victoria, which stands out like a sore thumb.
So what do we do now?
Well, as everyone knows, we're in 6 weeks of lockdown. My professional opinion on this is that we need to make good use of this opportunity and actually have a go at eliminating this virus. We need to actually make use of this lockdown and go a lot harder and see if we can get rid of the virus, get Australia completely clear of it, and then we can live in a relatively open manner until such time as a vaccine arrives.
But how possible is that? I mean, you know, we thought we had this thing just about beaten. In a number of states, they had 0 cases for a long, long time. Here it is again.
Well, we know it works because 6 out of 8 states and territories have achieved it. So every state and territory other than New South Wales and Victoria, with the exception of ACT now, had cleared the virus for 28 days. That is no community-acquired cases where you can't contact back to where they got it from. So we had actually eliminated in the majority of Australia. So we know it can be done based on that first round. And this time around, we could intensify our efforts and go harder. So we know that masks work. So why are we not seeing masks being worn by people in supermarkets, both the patrons and the staff? We know that the lockdown works. So why 2 houses up my street are tradies working on a house in a residential project that surely is not essential? We're not actually undertaking this lockdown in a serious enough manner to achieve elimination, and this will probably be our last chance to do it. Otherwise, Australia now, because we see how it links across the borders, will be living in this limbo land of suppression where we get outbreak after outbreak after outbreak, social upheaval and economic harms until such time as the vaccine arrives.
When you go out the street, do you wear a face mask?
Not at this point, because you need the face mask when you're on the public transport, which I'm not using at the moment, or when you go into the supermarket. So I'm actually going to go out and get my face masks tomorrow. So when I go to the supermarket, I've got them on and start leading by example. That's a fair call.
Okay, well, if it's good enough for you, I mean, it goes against the whole macho thing, but I might have to think about doing the same myself. Professor Tony Blakely, thank you so much indeed for your time.
My pleasure. I hope that was useful.